Why are medical billing codes so confusing? Imagine trying to read a language with thousands of words that change all the time. That's what medical billing codes are like. They are used to describe every service, procedure, and diagnosis during a healthcare visit. The two main types are current procedural terminology codes for procedures and international classification of diseases codes for diagnoses. These codes tell insurance companies what was done and why, so they can decide what to pay. For seniors, most claims go through Medicare or private Medicare Advantage Plans, which follow strict rules about which codes are accepted and how they should be used. There are many reasons these codes can be confusing. First, there are thousands of codes, and they change often. New codes are added, old ones are retired, and rules about how to use them are updated regularly. This means doctors, billers, and insurance staff have to stay constantly updated. For seniors, this can mean receiving bills with codes they've never seen before, or services they thought were covered might be denied because of a coding mistake. Code levels add another layer of complexity. For example, evaluation and management codes range from simple visits to complex ones. The right code depends on how long the visit was, how severe the health issue was, and how much medical decision-making was involved. Higher-level codes usually mean higher costs, which can impact how much seniors pay out of pocket if they have deductibles or co-insurance. Seniors often have multiple ongoing health conditions, which makes their care more complicated. They might need special codes for care coordination or managing chronic illnesses. These codes have strict rules about who can bill them, what documentation is needed, and how often they can be used. If these rules aren't followed precisely, claims can be denied, leaving seniors with unexpected bills. Medicare and Medicaid have their own billing rules, which can differ from private insurance. Some services requiring prior authorization and proving medical necessity is often a reason for claim denials. Seniors might not understand why a claim was denied, and sorting it out can take time and effort. Mistakes are common, like using the wrong code or missing important information, which can delay payments or cause denials. Upcoding is another issue. This is billing for a higher level of service than was actually provided. Sometimes it happens by mistake, but it can also be intentional fraud. Either way, it can lead to higher costs for health plans, which might be passed on to seniors through increased premiums or out-of-pocket costs. There are also rules about which codes can be billed together. Medicare uses the National Correct Coding Initiative to prevent improper billing, but understanding these rules can be tricky. If two codes cannot be billed together, one will be denied, which can delay payment or care. For seniors, all this confusion can mean receiving bills that are hard to understand, unexpected denials, and delays in getting the care or reimbursements they need. It can also lead to higher costs if services are denied or coded incorrectly. Many seniors relying on family members, patient advocates, or Medicare counselors to help sort through these issues. Learning about common codes and billing rules can help seniors ask better questions and catch errors early. Many health plans and Medicare offer resources to explain billing and help resolve disputes. Staying informed about changes in codes and coverage rules can also help avoid surprises. Remember, the complexity of medical billing codes comes from the large number of codes, their frequent updates, and detailed rules for their use. Knowing the basics and where to find help can make navigating this system easier and less stressful.